My name is Sarah Conti, and I am with Shelly Evia, Priscilla Ly, and Sydney Westervelt. We are all second-year pharmacy students at UConn, and we will be giving a brief overview of the Lustgarten Foundation and pancreatic cancer. At UConn, we are a part of Alpha Zeta Omega, a nationally recognized professional pharmaceutical fraternity that promotes professional philanthropy, fundraising, and advocacy within the field of pharmacy. The national president of our fraternity has chosen to support the Lustgarten Foundation this year in honor of several AZO members that have passed from this disease. EZO has supported the Lustgarten Foundation these past couple of years, and we have nationally raised over $100,000 through various charity events like virtual and in-person walks, bake sales, cornhole and beach volleyball tournaments, bingo card fundraising on social media, and at UConn we participate in Coins for a Cause, where UConn's dining services, community outreach, student business services, and various student-led organizations come together to raise funds for nonprofit organizations like the Lustgarten Foundation.
What is pancreatic cancer? The pancreas is an organ located in the stomach with an essential role in digesting and regulating the blood. It releases digestive juices, also known as digestive or pancreatic enzymes, into the small intestine through its exocrine function. The endocrine function consists of islet cells that produce the blood sugar. It regulates the hormones, insulin, and glucagon. There are multiple types of pancreatic cancer. The most common of the two is adenocarcinoma, while only 5% of the cancers are neuroendocrine pancreatic cancer. Adenocarcinomas are also known as pancreatic ductal adenocarcinoma. This cancer occurs in the lining of the ducts in the pancreas. Neuroendocrine pancreatic cancer consists of endocrine tumors that originate in the hormone-producing cells of the pancreas known as the islet of Langerhans cells. There are multiple stages of pancreatic cancer. TNM stands for tumor, node, and metastasis. The T category describes the size of the primary tumor and whether it has grown outside the pancreas. The node category indicates whether cancer has spread to regional lymph nodes. The metastasis category indicates whether the cancer has metastasized to other parts of the body. In 2021, there has been 60,430 cases of pancreatic cancer diagnosed. Additional statistics: pancreatic cancer is also known as the third leading cause of cancer-related death in the United States. A pancreatic cancer has the highest mortality rate. The 5-year relative survival rate is 11%. In 2022, there has been an estimated of 62,210 Americans will be diagnosed with pancreatic cancer in the United States, and more than 49,830 will die from the disease. Surgical removal is possible in less than 20% of patients diagnosed with pancreatic cancer.
Once a patient is diagnosed with pancreatic cancer, there are various treatments that can be considered. These treatments include surgery, radiation therapy, chemotherapy, ablation or embolization, immunotherapy, targeted therapy, or pain control. Before treatment is pursued, numerous factors are taken into consideration to pick the most optimal treatment for the patient. These factors include age or lifespan expectancy, the patient's comorbidities, the stage of pancreatic cancer that they're in, any side effects of the treatments, and also resection risk. There are numerous signs and symptoms of pancreatic cancer. Some early warning signs of pancreatic cancer include dark-colored urine, itchy skin, digestive problems, upper abdomen pain that extends to the back, or a loss of appetite. It is important to note that early-stage pancreatic cancer is often asymptomatic. Therefore, the early warning signs mentioned above could also be an indicator of other diseases and not just pancreatic cancer. Other symptoms of pancreatic cancer include jaundice, upper and middle stomach and back pain, nausea and vomiting, or gallbladder and liver swelling, while other indicators can include blood clots, unexplained weight loss of appetite, fatigue, fever, chills and sweats, and diabetes.
So why do we care so much about pancreatic cancer here at AZL? Well, that is because the Lustgarten Foundation is our philanthropy. It's a nonprofit organization which funds pancreatic cancer research with the goal of finding a cure. It also helps with spreading awareness and for the support of those affected by pancreatic cancer. It's the largest private funder of pancreatic cancer research in the world, and according to their website, they have funded over $225 million worth of research grants. At the time of the organization's founding, which was in 1998, pancreatic cancer was considered an orphan disease, which means that it wasn't a very common disease and affected less than 200,000 individuals in the United States. However, today that has changed. Pancreatic cancer is actually very common and accounts for about 3% of cancers and around 7% of cancer deaths. It was named for Mark Lustgarten, who is a former vice chairman of Cablevision, who unfortunately died of pancreatic cancer. But because of this, the organization was founded, and Cablevision currently underwrites for Lustgarten, basically assuming all liability. So we're going to go over some ways that you can donate yourself. The easiest way is probably directly through the website at lustgarten.org or at the donation link provided. It'll take you right to this page, and you can select an amount, and it's pretty simple. But there are other ways you can do this as well. So one of the ways is to walk for research. The Lustgarten Foundation holds fundraising walks across the country. The link provided here will help you find one near you. For reference, there's also going to be one in New York City in April and one in Milford, Connecticut in May. So those are for any of you who are local. You can also ask people to donate for your birthday. So very similarly to how people do on Facebook for their birthdays, they choose a charity to support. You can do that right through the Lustgarten website. So the link is right here, and all you have to do is click the green button that says Become a Fundraiser. You can also host your own fundraising event. Again, through this link, you just head there, click the green button, and become a fundraiser yourself. And if you have any questions, feel free to comment below or fill out the Google form in the video description, and we would love to get back to you. Thank you very much for listening to this video, and we hope you choose to donate.